Hi guys, welcome back to Codemaster Coach, your medical coding tutor. Today I want to introduce you to CPT. I've had so many emails requesting that I start to break down CPT as I'm doing ICD-10-CM, so I want to start and see if the need is really there. So again, let's start talking about CPT. What is CPT? CPT stands for Current Procedural Terminology. It's a classification system used to code physician procedures and services. These are procedures and services that are performed by a licensed MD. It contains a listing of all current and FDA, Food and Drug Administration, approved physician procedures and services. Individual code numbers have been assigned to identify all procedures and services. So, for example, 99201, that's an example of a CPT code, and that's an office visit or other outpatient visit for the evaluation and management of a new patient, which requires 3 key components: problem-focused history, problem-focused exam, and straightforward medical decision-making. Goes into more detail in your code books under that 99201 code. But I want to first introduce you to a CPT code, 99201. 99201 identifies a specific service for a new patient. We're going to break all of this down a little further, but I just want to introduce it to you today. The service identified in code 99201 is the history and exam that includes focusing on one and only one patient problem. An example of a single problem includes a history and exam for a mass on the arm or a patient who has a toothache. Note that the physician can make straightforward medical decision making. I'm going to break each one of these: straightforward medical decision making, and is not necessarily concerned with other patient problems. By having a code for each individual procedure by the doctor to a patient, insurance carriers across the country will be able to do several things. 1, communicate more effectively with each other, physician to physician. Compare reimbursable amounts for procedures, because it's a straight code. It's not a description in layman's terms. It's a straight code. I charge how much for 99201 versus how much do you charge for 99201. So it's just a code that we have to compare, not language, not spelling and words. And in 3, it speeds up the processing of claims because, again, it's a computer-generated number. Okay? There are 6 major sections of CPT, and I want to break them down for you. Number 1, first, the patient comes to the office to find out what the problem is. That's evaluation and management. Once it's decided that the patient needs an operation, he or she is anesthetized. Anesthesia, section 2. After the patient is under anesthesia, the surgery begins. Surgery, section 3. The patient might be undergoing a diagnostic surgical procedure that requires intervention and assistance of a radiologist. 4, radiology. The patient might be undergoing a biopsy that requires the assistance of a pathologist. Upon its removal from the patient, the specimen is taken to the lab for an examination. 5, examination, pathology and laboratory. And often the patient is released from the hospital with a prescription for several kinds of non-surgical treatments or tests such as EKGs, psychological testing, or physical therapy. 6, the medicine section. Okay? So we have E&M, anesthesia, surgery, radiology, path and lab, and medicine. All CPT codes are composed of 5 numeric digits. The first number in a CPT code depends on the section in which the code is found. So you can look at a code and just from its first number determine what section that code came from. Codes in the evaluation and management begin with the number 9. Codes in anesthesia begin with 0. Codes in the surgery section begin with 1, 2, 3, 4, 5, and 6. Codes in radiology begin with the number 7. Codes in pathology and lab begin with the number 8. And codes in the medicine section begin with the number 9. So again, E&M and medicine can be tricky, but when you look at what's going on with your patient, you'll understand whether it's a setting like ER, office, type visit, that 9, or some type of service that's rendered to the patient, that 9. Okay? So we have codes 9, 0, 1, 2, 3, 4, 5, 6, 7, 8, and 9 as the beginning number. Although CPT describes physician procedures and services, it does not include some other items that need to be reported to insurance carriers, such as ambulance services, wheelchairs, and an extensive list of drugs used for individual injections. That can be found in HCPCS. Now I have an old HCPCS book. The HCPCS, which is Healthcare Common Procedure Coding System, employs CPT for the coding of physician procedures and services, but other levels were provided as a method for coding items not found in CPT. So have you ever gone through your CPT book and wondered, where are wheelchairs? Where are ambulance services? Where are, what are the surgeries? Breast implants? Where are these other services? Dental? Where are these other services that I can't seem to find in CPT? Okay? So you have two different books. You have your HCPCS, HCPCS, and CPT. The main one we code for are CPT. Usually your HCPCS are charge master driven. And what does it mean to be charge master driven? It's kind of like when you go to a grocery store and you can go to the self-checkout because you have a barcode on your grocery item and the computer can read that barcode. Well, that's what happens in healthcare. The IV bag usually has a little sticky on it. That sticky can be scanned and a charge can be generated. That charge or that sticky identifies the HCPCS code for that supply. So a lot of times we don't, as coders, we don't have to worry about this, but it's good to be familiar with it. So that's where those other things that you don't see in CPT come from. It comes from HCPCS. So again, what is HCPCS? HCPCS is an acronym that stands for Healthcare Financing Administration's Common Procedural Coding System. CPT is considered to be level 1 of HCPCS. CPT is level 1 of HCPCS. HCPCS codes or national codes are used to bill procedures and services that include dental work, durable medical equipment, injections, ophthalmological services, orthotics, and some pathology and lab services, some rehab services, and many supplies and vision care. So if I were to give you some examples of some services that could be done between CPT and HCPCS, for example, ambulance service. If you've ever gone through your CPT book, you notice you don't see ambulance services. Why? Because where you do see is when the physician's involved, but ambulance services are usually rendered by EMTs. And because EMTs are not licensed MDs, we can't capture those codes in CPT. They're captured in HCPCS. Because remember, we said CPT are physician-rendered services. And so that's what we're going to do as we go down this list. Chiropractic. A chiropractor usually is a licensed MD. So that can be generated in a CPT code, his services or her services. Chemotherapeutic drugs, that's a supply. It's found in HCPCS. Consultations. Now, consultation can be done in healthcare under a licensed MD, or it can be done in other healthcare settings. We have other healthcare providers. So consultation can be a CPT or a HCPCS code, either one. You can find them in both. Dental. Dentists, licensed dentists are MDs. So a lot of dental procedures can be found in CPT, but majority of them are found under HCPCS, okay, like fillings and such. But that actual office visit, we can generate a CPT code for. Durable medical equipment, again, a supply, that's HCPCS. Hospital visits, that's a licensed MD, that's CPT. Injections, like drugs. Now again, some injections, like the injections that are done in the ER for the infusion, that's in CPT. But other medications are found in HCPCS. Okay. Office visits under a licensed MD, CPT, in other healthcare settings, HCPCS. So that can go both. Ophthalmologic services, eye, because some eye services are done in healthcare under licensed MD, that's CPT. Others are done for cosmetics in your eyeglass places, that's HCPCS. Orthotics and prosthetics, that's a supply, that's HCPCS. Pathology and lab, there is a pathology and lab section in CPT, and then some of them are supplies for pathology and lab, and that's in HCPCS. Rehab services, when you go into a rehab facility, the director of the rehab facility is a licensed MD. So that's where your CPT code comes in. But the supplies that physical therapy, occupational therapy, etc. use are HCPCS. Supplies in general for healthcare, emesis basin, toothpaste, everything else is a HCPCS code. And in surgery, is done usually under a MD, licensed MD, that's CPT, but depending on which healthcare setting you're in, it can be a HCPCS code. And in vision services, again, can be under CPT and HCPCS. HCPCS codes are 5-digit alpha numeric codes. And they're usually, again, charge master driven. So a lot of times your purchasing department will put the supply code in the your hospital system, and as those services are used, the HCPCS code is auto-generated through your charge master. Okay guys, so I've introduced you to CPT, and I gave you a little background on HCPCS as well. So I hope that gives you a little better understanding, and we can move forward with CPT coding now that I've given you the foundation. If you have any questions, email me at codemastercoach@gmail.com. If you like a transcript of this video, I'm amazed at how many people are asking me, can you send me the lesson plan? They want a written transcript of this video. Let me know. I'll call it CPT Volume 1 so that I won't get these mixed up with my ICD-10 CM lesson plans, okay? All right, guys. Thanks a lot. I'll see you in the next one.